urinary tract, specifically malignancies of the upper urinary tract and urinary bladder. If we go back to the embryology, upper urinary tract consists of the renal pelvis and the ureter, which are of mesodermal origin, whereas the urinary bladder and urethra are derived from the endoderm of the urogenital sinus. But despite these differences in the histogenesis, the entire excretory urinary passage is covered by the urothelium, otherwise known as the transitional cell epithelium. So, the commonest malignancy that occurs in the urinary passages is of the transitional cell nature or the urothelial nature. Then there are more similarities than differences in the tumors arising in the upper tract versus the urinary bladder. But the upper tract carcinomas differ from the urinary bladder carcinomas in the following ways. They are less frequent, occurring in only 5 to 10% or accounting for only 5 to 10% of all urothelial tumors, whereas the bulk of the urothelial malignancies is made up by the urinary bladder. Secondly, they have a strong association with long-term analgesic abuse, particularly phenacetin consumption and urinary tract obstruction. Then they are associated with increasing frequency with synchronous or metachronous malignancies in other parts of the urothelium, like in more than 50% cases, upper tract carcinoma is usually associated with a concurrent carcinoma in the urinary bladder, and in 5 to 10% of cases, there is a contralateral upper tract carcinoma. Then they tend to have or tend to present at a higher histologic grade and at a higher stage. In more than 60% of upper tract urinary carcinomas, by the time we have diagnosed it, it would have already invaded, as compared to only 15 to 25% of urinary bladder tumors. And they tend to peak between the 70 to 80s with a male to female ratio of 3:1. Clinical presentation: almost all urinary tract malignancies present as gross or microscopic hematuria. There may be flank pain, there may be a lumbar mass. Prior history of bladder cancer should be ruled out, and those who present with systemic symptoms like anorexia or weight loss or fever, a rigorous metastatic evaluation should be done. Now coming to the classification. There has been significant controversy and debate regarding the classification of urothelial carcinomas from the time, since the last several decades, from the time it was first proposed by the WHO